then, being a parent seemed so easy. Little did you know. Now, you are beyond tired and don't know how you will ever recover. To make things worse, my favorite pastime seems to be crying, loud and long.
Crying is normal and is the only way that babies know how to communicate. In fact, the average baby may cry up to 3 or more hours per day, with crying periods lasting up to an hour or more. Generally, at about 2 weeks of age, babies will begin to cry more often. The worst crying phase will peak at around 6 to 8 weeks of age. During this peak, you can expect even longer crying periods, especially in the evening. Your baby's intense fussing and crying should significantly decrease at about 3 to 4 months of age. But until then, let's figure out how to cope with the tears.
First, ask yourself whether your baby's basic needs have been met. Is your baby hungry? Infants should be fed around every 1.5 to 3 hours. Did he just eat and needs to burp? Does your baby need a diaper change? Check your baby's temperature. Is your baby too hot or too cold? Is your baby sick or have a medical issue such as reflux, constipation, or digestion problem? Does she just need to be held and comforted? Is your baby tired? Newborn babies need at least 16 hours of sleep per 24-hour period. As a rule, infants up to 5 months of age should only be awake for 1 to 2 hours at a time before their next nap occurs. If they are awake for more than 2 hours at a time, they are likely to become overly tired, cranky, and unable to calm down or fall asleep easily.
If all of your infant's basic needs have been met and your baby is still crying, it may help to try a combination of the following calming techniques. Hold your baby. Babies love to be held and may have a preference for a specific holding position. Try standing rather than sitting, or facing your baby outward rather than inward. Some like to be held on their stomach in the football clutch, while others may prefer looking up at you. For additional comfort, try patting your baby's back, holding him skin to skin, or swaddling him in a blanket. Check with your doctor for proper swaddling techniques.
Create motion. Babies respond well to movement, so rock your baby in your arms or in a baby swing. Gently bounce him on your knee, go for a walk around your house or outside, or take your baby for a drive.
Create sound. Soothe your baby with sound by shushing in his ear, singing, talking, playing music, or even vacuuming.
Offer your infant a pacifier. Help them find their own thumb to suck on, or nurse them briefly, as sucking can help trigger their calming reflex. Remember that pacifiers need to be replaced if they show any sign of deterioration, such as cracks, discoloration, holes, tears, or weak spots. Keep pacifiers clean and do not coat them with any substances. Also, avoid attaching strings or cords to the pacifier.
Sometimes your baby may not respond to anything and will continue to cry, often for no reason at all. If you become frustrated, do not shake your baby. Shaken baby syndrome occurs most often when a parent becomes frustrated and violently shakes their baby with the hope that their infant will stop crying. However, shaking a baby can cause permanent brain damage or even death. Forceful shaking movements toggle the infant's brain back and forth, hitting the inside of the hard skull multiple times. This movement will tear fragile brain tissue, rupture blood vessels, and cause bleeding and swelling. These type of brain injuries are most often seen in infants, although they have been seen in children up to 5 years old. So again, never, ever shake your baby or your toddler or your preschooler.
Instead, when you feel frustrated, stop and recognize your emotions. Know your own tolerance level to inconsolable crying. Do not allow yourself to become out of control. Take a deep breath and count to 10. Continue breathing slowly and calmly. You need to be able to care for your baby in a non-angry, non-frustrated way. If you cannot do this, put your baby in a safe place and walk away. It is okay to let your baby cry while you give yourself a break. After you have calmed down and are emotionally in control, check on your baby and try again. If you cannot remain calm, or if you become upset or angry, call a family member, friend, or your doctor for help.
Remember, crying is normal. We're not trying to annoy you. We're just being, well, a normal, healthy baby and growing extra strong lungs so that we can become a future trumpet player, opera singer, or long-distance runner. So hang in there. It will be worth it.